Hi, my name is Hannah Friedman. I am a psychiatric registered nurse and I have been practicing for a little over 5 years now. I'm here to speak on a bill that I hope to be passed into law because I think it's a vital bill or law that should be enacted for every single person that will ever receive hospital care in the United States. This bill is H.R. 2530, Nurse Standards for Hospital Patient Safety and Quality Care Act of 2023. This bill, the whole purpose of this bill is to set safe nurse to patient ratios. And when I say nurse to patient ratios, that is how many patients one nurse can effectively take in their shift. They have explicitly broken down each specialty of what is safe for the specialty. So, such as intensive care units or NICUs, there should be one nurse for every two patients. Now, other units such as medical, surgical, or post-op, there should be one nurse for every four patients. They have broken it down specifically based on the acuity of the patients that that floor would see. This is important because today we have seen research after research that there's no regulation of how many patients one nurse can take, and there are poor patient outcomes that continually happen. They say that there's higher mortality rate of patients. There is a higher risk of being readmitted after discharge. And then there are actually longer hospital stays for having no mandated nurse to patient ratios. The next important part about this bill is that it lets hospitals have a say in how they determine these patient ratios, in that they have to set specific procedures in how they run as a hospital to mandate these set nurse to patient ratios. So, based on acuity of the patients that they receive, the planned admissions, the planned discharges, such things that happen on the unit, the hospitals are responsible for making procedures that work along with that. The other important part about this bill is that it sets nurses in a more protective factor of being retaliated against. When nurses advocate for themselves and their license, but also for their patients in refusing a patient assignment, A, because they have reached the maximum ratio, or that they feel like they don't have enough education or experience at, this bill provides some support and protection of that retaliation that those hospitals can take on those nurses simply for advocating for their license and the safety of their patients. We've talked about how there are research studies about the poor patient outcomes with the unmandated nurse ratios. But also, there's so much studies and so much research about nurses leaving the bedside, and that there's this nursing shortage that has been predicted for many years, and it's only planned to get worse because not only are the nurses retiring out, it's all the nurses that are leaving bedside because they are feeling burnt out. So, once again, this bill is vital for not only retaining nurses at the bedside, but to provide the best patient care that they can in any hospital setting because it sets a standardized nurse patient ratio that is safe and effective. Thank you for your time, and please feel free to contact me if you have any more questions or would like any more information. Have a great day.